Are you prepping for the NCLEX? Well, let's walk through some key questions that you'll need to know. And if you want a ton of questions with rationales for free, simply click the link in the description below to create your free Simple Nursing NCLEX account. All right, let's walk through this case study together. And always remember, mentally highlight the key terms that risk safety. So starting at the top. So step number 1, always think of 3 things that are going to either kill or harm for blood transfusions for symptomatic anemia. Now, before looking at the nurse's notes, always think of 3 things that are going to kill or harm. So number 1, think about low RBCs or even low H&H. This means decreased oxygen carrying capacity. And remember, H&H, hemoglobin less than 7, sends your client to heaven. Now, number 2, underlying causes could be iron deficiency anemia. And number 3, watch for potential blood transfusion reactions. Now, step number 2. Let's look at the tabs and mentally highlight keywords that risk safety. So under tab number 1, I'm looking at type and cross-match for 2 units of PRBCs, those packed red blood cells. So this is a big safety consideration related to blood products. We have to have proper IV access, as well as verification by 2 RNs, and always watch for signs and symptoms of any type of reaction. Now clicking over to tab number 2. At 9:30, the findings are unremarkable. There's no real safety issues here. Also with 9:45. But now look down to 9:55. We see reports of widespread pruritus, also difficulty swallowing, and even a headache, as well as, here's a big one, bilateral wheezes. So the lungs are getting very congested and tight. So this is a blood transfusion reaction. Now let's click over to tab number 3. We see an increased temperature at 100.5 or 38.1 degrees Celsius. The respirations are a little high at 22 breaths per minute, and the oxygen saturation is technically normal, but it's down to 95% from 99%. So remember, on the NCLEX, sudden changes or rapid changes are bad. So these changes in vital signs are very concerning. We're thinking possible transfusion reaction. So step number 3, always remember, find the key words before looking at the item or the question. So now that we found each key term that risks safety, you can now go through each item more confidently when answering the specific questions. So don't be scared, be prepared. Simply find each key word that risks safety before jumping into the questions. This question's asking us, click to highlight the orders that require clarification by the nurse. The problem here is a blood transfusion for treatment of symptomatic anemia. So for the solution, before looking at the options, always think about safety first. Simply think what kills or harms the client. So with transfusion reactions, remember, we have 4 different types of reactions. First is febrile. We see a mild allergic reaction. Second one is anaphylactic reaction, a full-blown allergic reaction here. So we see hives and even hypotension, that low blood pressure. Next is circulatory overload. Simply think heavy fluid in the body. And the last one is very dangerous. It is hemolytic reaction. This is where the red blood cells break inside the body, or basically explode. And we often see lower back pain as the kidneys are getting overloaded with these dead RBCs. So now let's dive into the case study. First, let's look at the nursing notes. At 9:30, we have unremarkable findings. Same thing for 9:45. But at 9:55, we see widespread pruritus, difficulty swallowing, headache, and hives. Also bilateral wheezing, and a temperature of 100.5, or basically 38.1 degrees Celsius. So this is a possible anaphylactic blood transfusion reaction. And this will kill the client. So it's your job to keep the client safe.
Now, let's go to the matrix question.
This question's asking, for each client finding, click to specify if it indicates anaphylactic reaction, febrile, or even hemolytic blood transfusion reactions. So each finding may support more than one type of reaction. The problem here is which type of blood transfusion reaction. So for the solution, before looking at the options, think about different types of transfusion reactions and the signs and symptoms of each. So number 1 is febrile reaction. We see a fever with mild allergic reaction, including flushing and itchiness. Number 2 is anaphylactic reaction, the full-blown allergic reaction. So we see fever, hives, shortness of breath, even hypotension, that low blood pressure. Next is circulatory overload. So simply think fluid volume overload or think heavy fluid in the body. Naturally, the client's going to present with shortness of breath, crackles, and even JVD from all that fluid buildup in the body. Now, the last one here is hemolytic reaction, where the red blood cells burst inside the body. So we often see lower back pain as the kidneys are getting overloaded, as well as low blood pressure and even a fever. Okay, now let's look at the options. First, we're going to look at the first column, which is anaphylactic reaction. So will hives be present? Yes, hives can be present with a severe allergic reaction. We're also going to see fever, as well as pruritus, that itchiness of the skin, and even hypotension, that low blood pressure. Now, hypotension is the most life-threatening because it's going to drop the blood pressure so low that it's going to kill the client. We'll also see bilateral wheezing as the airway gets constricted from all that inflammation in the body. Also, difficulty swallowing, which again is like a normal allergic reaction, just blown up to a more severe degree. Now, moving on to febrile reaction. So number one, we're going to see hives. Now, this may be associated with a mild allergic reaction. We'll also see a fever because simply let the name help you. Febrile reaction means a fever. Also pruritus, that itchiness of the skin, but not hypotension, that low blood pressure. And we won't see bilateral wheezing or even difficulty swallowing and not lower back pain. Now, what about the last column here, the hemolytic reaction, where the blood cells burst in the body? So number one, we're not going to see hives, but we may see a fever. So we'll check the fever box. Now, pruritus, we won't see that itchiness of the skin, but we will see that hypotension, that low blood pressure, as all those red blood cells burst in the body. And then bilateral wheezing, we're not going to see because that's more for inflammation. Also, difficulty swallowing is more for inflammation. But the classic sign here, and you must write this down for the NCLEX, low back pain. Simply think all those red blood cells are bursting and now they're clogging up the kidneys, causing that low back pain. The question's asking us to complete the following sentence by choosing from the list of options. The problem here is a transfusion reaction. So for the solution, before looking at the options here, always think of the data presented in the scenario. So we see fever, we see hives, as well as wheezing, that inflammation in the lungs. So we got to be thinking anaphylaxis with that airway constriction. So let's walk through the question. The nurse identifies that the client is most likely experiencing blank transfusion reaction based on blank. So now let's look at the options here. The nurse identifies that the client is most likely experiencing blank. Well, anaphylactic reaction is the correct choice because the wheezing and shortness of breath. Remember, this is just simply a severe allergic reaction. Now, it's not going to be a febrile reaction because that would include increased temperature in several types. And it's not going to be a hemolytic reaction because the client would present with low back pain and low blood pressure. All right, so we chose the anaphylactic reaction. Now, what is this based on? Let's look at the clinical findings. Well, is it going to be a fever? Well, we can have a fever with several types of reactions, so it's not the best choice. But wheezing is the best choice. Simply think of a full-blown allergic reaction. We're going to see airway constriction. That is the most classic sign. Now, the last one here is hives. This one's super non-specific and can indicate mild or severe allergic reactions. So that's not the best choice. All right, so the correct answer here is the nurse identifies that the client is most likely experiencing an anaphylactic blood transfusion reaction based on the wheezing. Whoa! Head to the link in the description below for way more NGN rationales just like this. All right, let's dive into this question. For each nursing intervention, click to specify if it's indicated or contraindicated, basically a no-no. And it has to be based on the current clinical data. The problem here is an anaphylactic reaction, basically a full-blown allergic reaction due to a blood transfusion. So for the solution, before looking at the options, don't be a dum-dum and kill your client. Always think about safety. So number one, stop any infusion that's causing a reaction. Simply think, you got to stop the infusion to stop the reaction. Then use new tubing and flush the body with IV normal saline. Next, you got to report to daddy or the HCP any immediate findings that risk safety. So don't kill your client by delaying reporting to the HCP. And then very lastly, assess vital signs and take urine specimen. All right, now let's dive into the options here. So starting with what's indicated. Are we going to notify the client's healthcare provider? So yes, we want to notify daddy when things go wrong. So always notify the HCP if the client is in distress. What about stopping the blood transfusion? Of course, this should be your first action. Don't be a dum-dum. Stop anything that's going into the client that's causing a reaction to stop the reaction. Now, what about starting 3% sodium chloride infusion? No, we should not be using 3%. That's super salty. We should always be using normal saline, 0.9% sodium chloride. So this one is contraindicated. What about assessing the client's vital signs? Well, of course, on the NCLEX, you gotta assess. So remember, safety considerations, we always check the vitals and simply assess the client. Now, how about assessing the client for other symptoms of a transfusion reaction? Of course, you want to assess the client to death on the NCLEX. Now, how about the next one? Initiate a code blue. Are you really going to get on the client's chest and start pumping their chest? Well, no, this is contraindicated. Vital signs currently are stable, so you're not going to be resuscitating the client. How about the last one here? Treat the client's symptoms per standing protocol. Duh. Yeah, of course you are. So implement standing orders to manage those symptoms. Don't just take a lunch break or clock out for BTO. All right, let's dive into the dirty details of this question. So the question's asking us to complete the following sentence by choosing from the list of options. The problem here is priority actions in a transfusion. So for the solution, before looking at the options here, think about safety. Don't be an idiot and kill your client. So number one, we always stop the infusion that's causing the reaction. So on the NCLEX, anything that's causing a reaction, stop the infusion to stop the reaction. Then we use new tubing and flush the body with IV normal saline. Next, we're reporting immediately to daddy, or basically the HCP. And then very lastly is assess the vital signs and take a urine specimen. All right, so now let's dive into the question here. The nurse must first blank contact the HCP and then blank. So personally, I'm thinking the nurse must clock out for lunch and then ask for vacation time. I'm just kidding. Okay, let's do this. So the nurse must first, let's look at response number one. Is it going to be stop the blood transfusion reaction? Well, think about it. Is this the safest thing to do on the NCLEX? Well, of course it is. This keeps the client safe from receiving any more things that are going to cause a reaction. So again, stop the transfusion to stop the reaction. Now, the other two options are wrong because we only infuse normal saline at a maintenance rate, but after stopping the transfusion. And we have to give that normal saline through a new tube. And the last option's wrong because we don't have to activate a rapid response team. The vital signs are stable and it's not a priority action right now. All right, cool. The nurse must first stop the blood transfusion to stop the reaction. Then we contact daddy, or basically the HCP, and then what are you going to do next? So let's look at response number two. Are we going to request a prescription for acetaminophen? No, what is that going to do for the client? Simply giving him a pill of Tylenol. No, it doesn't address the allergic reaction or the anaphylactic reaction. How about obtain a blood and urine analysis per facility guidelines? No, first off, forget the facility policies. Your client is dying here. We got to treat the client first. This anaphylactic reaction is going to kill the client. So we have to administer the prescribed dose of IV antihistamine. Even if you don't know what antihistamine was, think about it. It's a life-saving intervention for this life-threatening allergic reaction. So simply give the antihistamine to save the client's life. All right, it's that time again. Let's break this question down. The question's asking which client finding indicates a successful outcome. Select all that apply. Honestly, a successful outcome is them signing out AMA. Ha, got him. Okay, but for real, the problem here is assessing after interventions for an anaphylactic transfusion reaction. Super fancy words for a full-blown allergic reaction that's going to kill the client. Before looking at the options, simply think about safety. How are you going to save this client's life? Well, we want to see improvement of breathing, so no more shortness of breath and no more wheezing. Also, a reduction of those hives on the skin and even itchiness. Now, let's look at the options, and let me explain the rationales here. So the first option is incorrect. The client's face is still flushed. Remember, facial flushing is associated with a transfusion reaction. It's not just because you're shy or embarrassed. So this is not considered an improvement. Now, the second option is correct here. The client reports less itching. So yes, less itching means improvement. Now, if you just came back from that bachelorette party or that nurse cruise and still have the itching, I get that checked out. Now, the third choice here is the client's SpO2 is at 96% on room air. So this is within normal limits. This is actually a good sign. So it would also be correct. Now, the rest of the options are incorrect. And let me explain why. The nurse's temperature remains elevated, so that's not an improvement. And in the next option, the client continues to experience wheezing. So this indicates airway constriction. So that's not an improvement either. And in the last option here, the client's mouth is still suctioned to maintain airway clearance. So again, no improvements in airway patency. So that's why option 2 and 3 are the most correct here. Okay, now for the drag and drop question, or as I like to say, drag and drop it down low like there's money on the flow, ay. All right, it's that time again. Let's answer another question. So the question's asking us to complete the following sentence by choosing from a list of options. The problem here is admission assessment for severe burns. So for the solution, before looking at the options, what do you know about burns? And I'm not talking about your mom. Burned. Okay, seriously. Okay, so the two things you know about major burns. Well, number one is massive tissue damage and cellular destruction. This leads to leaky blood vessels. So remember, severely low fluid volume inside the vessels means hypovolemic shock. And anytime you see the word shock, you have to think severely low blood pressure that will kill the client. Now, the second thing you have to think about is a huge risk for infection, since the epidermis, or basically the skin, is the first layer of protection against infection. All right, now let's answer this question here. The client is at risk for developing blank as evidenced by the client experiencing blank and blank. All right, so let's look at the first column here. The client is at risk for developing blank. Would it be hypokalemia? Well, think about it here. Hypokalemia is low potassium. Well, with the damaged cells, that releases high potassium into the bloodstream. So we'd expect hyperkalemia, that high potassium. And we're not going to see hyponatremia, that low sodium, because of all the fluid imbalances here. Now, what about hyperthermia? Well, the lack of oxygen from tissue ischemia would actually cause hypothermia. Think about it here, that low body temperature, because remember, the skin is simply a covering, or basically a jacket for the body. So we'd experience low temperature and not high temperature with hyperthermia. Now, what about the last option here? Hypovolemic shock. So let the name help you here. Hypo meaning low and volemic meaning volume. So yes, low fluid volume inside the blood vessels leads to that hypovolemic shock. And this is going to kill a client from low blood pressure. Okay, so now back to the question. The client is at risk for developing hypovolemic shock because, again, that's going to kill the client first, as evidenced by the client experiencing blank and blank. So simply think about hypovolemic shock and look at the client findings here. Is it going to be hypotension? Well, of course, low fluid volume in the blood vessels kills the client from low blood pressure. How about the next one here? Tachycardia. Now, this one is a little bit tricky, but simply think about the body here. The heart rate increases to help compensate and perfuse the body with the limited blood it has. So yes, this would also be correct. Now, it's not going to be bradycardia. We would expect a high heart rate, not a low heart rate, because remember, the body has low volume in hypovolemic shock. And it's definitely not going to be hypertension because, again, let the name help you here. We would expect low blood pressure with low volume in the body. All right, you future nurse, let's break this question down. The question is asking for each step of the nursing process for an NG tube insertion. We're going to click to specify whether the nursing action would be appropriate for the care for the client. Now, each step in the nursing process may support more than one potential nursing action. So the problem here is simply inserting an NG tube for decompression. So for the solution, before looking at the options, think about important nursing considerations related to NG tube insertion. So number one, we have to identify possible contraindications for NG tube placement. So simply think nasal surgery or even deviated septum. Number two is always assess the bowels. And then very lastly, position the client upright and always have the right measurements from the bridge of the nose, then to the earlobe, down to the xiphoid process. All right, now let's dive into the options. So what are the potential nursing actions here? Are we going to identify the client using at least one identifier? No, of course not. We need at least two client identifiers. How about asking whether the client has a history of nasal surgery or even congestion or allergies? Well, yes, safety is number one. So nasal surgery is a possible contraindication of sticking a big old tube down your nose all the way to the stomach. What about auscultating or simply listening to the abdomen in all four quadrants? Isn't that a waste of time? Well, no, it's not. Evaluating bowel sounds or GI motility before placing the tube is absolutely essential. Remember, on the NCLEX, you have to assess before your interventions. What about the last one here? Assessing peripheral pulses bilaterally. Are you going to stick a tube between the toes? No, you're sticking it down the nose and not the toes. So assessing the peripheral pulses here is simply a waste of time. Now, what about planning and implementation of the insertion? Well, are we going to prepare and organize the NG tube equipment at bedside? Think about it. Can you just throw in an NG tube with no equipment? Of course not. So we're definitely going to have to get all supplies before beginning insertion. So this option is obviously correct. Now, what about the next one? Position the client upright in high Fowler's position. Of course. Simply think about the NG tube that you would insert on the Sims mannequin. You would have that Sims mannequin upright for that NG tube insertion. How about the next one? Measure the tube from the bridge of the nose to the earlobe and then down to the xiphoid process. Yes, once again, we have to determine the length to insert the tube. How about instructing the client to tilt their chin up in the air? Think about it. Is that tube really going to go in if the client's head is up? Well, no. We should have the client tilt their chin down to swallow that tube and go into the stomach. Okay, now moving on to the last section here, implementation of decompression and irrigation. So starting with verifying placement per agency policy. Do you want to verify placement per policy? Well, yes, this is a huge safety consideration. We got to make sure the tube is in the right place because let's say the tube gets displaced and now goes into the lungs, and then we start filling up the lungs with the feeding. Definitely not something we want to do. How about the next one here? Clamping the tube or connecting to a drainage bag or a suction source? Well, yes, of course. The tube is used for decompression, so we have to decompress by sucking things out. How about the next one here? Apply the tube fixation device to the nose and then fasten the NG tube to the bedside rail. Wait, what? Rail with tape? No, that's almost like fastening it to a doorknob. So the correct thing to do here is to secure to the gown as well as securing it to the nose just to make sure it doesn't get displaced. What about the last option? Flush the NG tube with saline water and often check resistance. This one was really tricky and really close, but this one is incorrect. We only really flush before and after medication, not just willy-nilly whenever we want. All right, it's that time again. Let's answer this question. This question's asking for each statement. We have to click to specify if the statement is accurate or inaccurate. The problem here is a pulmonary embolism, or basically a PE, and we're not talking about physical education. We're talking about a blood clot in the lung that can kill the client. So for the solution, before you look at the options, what do you know about a PE? Well, obviously, it's a medical emergency. It's a blood clot in the lung, and it obstructs the pulmonary vessel, usually the pulmonary artery. So the client dies from a lack of oxygen, or really the lack of the ability to get oxygen. Now we have to be thinking that the blockage prevents blood flow to the alveoli, the lung sacs that exchange oxygen. So we see a decrease in oxygen to the body, manifesting as hypoxemia. All right, finally, let's dive into the options. Starting with the first row, a PE is a blood clot in the lower extremity. No, a PE is a blood clot in the lungs, so that's inaccurate. All right, shoot me with the next one here. A PE is a clot in the artery of the lungs. So yes, the key terms, artery of the lungs, is correct, so this one would be accurate. Now how about the next one? A PE will require me to wear oxygen long term. No, this is totally incorrect. Simply think it's a clot inside the lungs, so when we remove the clot, we remove the problem. How about the next one here? A PE is treated with blood thinners. Well, simply think about it. It's a clot in the lungs. So what's going to thin that clot? Well, yeah, it's a blood thinner. So yes, this one is correct. How about the last one here? A PE can be fatal. Well, yes, physical education like running laps in high school can definitely be fatal. All right, no, but seriously, yes, a PE inside the lungs, basically a blood clot in the lungs, can kill your client because it clogs up the oxygen capability of exchanging oxygen. The only thing I like less than bow tie questions is bow tie pasta. I'm way more of a fettuccine type of guy. Okay, now for the big mama, the bow tie questions. So let's dive into this, but always remember the key strategies to guide your success here. So starting with the ask. The question's asking, complete the diagram by dragging the choices to identify number 1, the condition, number 2, the specific actions to address the condition. Basically, they're asking you how to save the client's life. And then number 3, the parameters to monitor for, to basically keep the client safe. Now for the problem here. Let's look at our case study and find keywords that risk safety. So starting at the top, we see the client is admitted for bilateral pneumonia, fancy words for infection in the lungs, as well as mild shortness of breath from the infected lungs. So let's click under tab number 1 and see what else we find. Well, would you look at that? All the vital signs are all messed up. Oh no. So number 1, the temperature is borderline high at 100.2 or 37.9 degrees Celsius. Now again, it's a tad bit high and it's on the border of being a fever, but it's probably from the infected lungs. Now the respiratory rate is at 27 breaths per minute, a little bit high. The heart rate is at 123 beats a minute, so again, that's a little high. But here's the key term, the blood pressure. Look how low that baby is. 86 over 52. Super low down to the flow. So the biggest thing I'm thinking here is septic shock. Remember, severely low blood pressure indicates shock, and especially the septic part because the lungs are infected with that pneumonia. Now, in terms of oxygen saturation, it's at 87%. Man, woo, that's so low. Reminds me of my credit score in nursing school. And the client is on 2 liters of oxygen via nasal cannula. So again, that O2 sat is super low. Now, stop here. You have a lot of information, right? So simply think, what kills this client first? Well, obviously the low blood pressure and the infection. So we have to be thinking severely low blood pressure, think S for shock. And from the infection, we're thinking septic shock. Now let's click over to tab number 2 and see what else we find. All right, so now looking at tab 2, woohoo, look at that WBC count. It's at 15,000. Oh my gosh. So now we see we have an infection and a low blood pressure. So it's definitely septic shock. But let's continue to review. The RBCs are at 5 milli, so that's okay. But the hemoglobin is at 16. Now, how do you know that's okay? Well, anything less than 12 is concerning. But remember, anything less than 7 sends your client to heaven. Now, what about hematocrit? That one's at 38. Now, this one is not too important, so a big NCLEX tip. Even if you don't know the normal range for hematocrit, simply look at the hemoglobin levels to help guide you. Because remember, when hemoglobin is low, hematocrit is also low too. Now, what about the platelets? 375,000. Well, remember, anything less than 150 is very risky. So it's well above that. Now, in terms of the solution, before looking at the options, always base your data findings on what you think will kill or harm first. Now, as mentioned before, we're thinking septic shock here. And again, here's why. The question stated that the client is admitted for bilateral pneumonia, that huge infection in the lungs. And the vital signs show borderline high temperature at 100.2. So that indicates an infection. But here's the kicker. Look at the WBCs. It's at 15,000. So it probably reminds you of your Sephora credit card bill. Huge infection here. Now, the last big one is the severely low blood pressure. You have to think S for severely low blood pressure as S for shock. So it must be septic shock. That's why option number 1 is correct. Septic shock, you think severely low blood pressure in the presence of an infection. Now, the other options are incorrect, and let me explain why. In option 2, ARDS, or acute respiratory distress syndrome, we think ARDS is hard lungs, basically hard alveoli. Now, the oxygen level is still at 87% on 2 liters. Now, it's low, but not low enough to be considered ARDS with that hard lung. What about in option 3, cardiogenic shock? Well, again, cardiogenic shock occurs when the heart fails as a pump. Think about cardiac failing in cardiogenic shock. But simply think about the cause of the vital sign changes here. We see bilateral pneumonia with increased WBCs. So that's obviously an infection, not the heart causing the problem here. Now, the last option is incorrect because a pulmonary embolism is simply a blood clot in the lungs, usually the pulmonary artery. And these clients have deadly hypoxemia, along with severe chest pain. But the data did not show any type of chest pain here, so this one would be incorrect. All right, now moving on to the nursing actions. So again, before looking at the options, simply look at the data in the case study, and then think, which actions will save the client's life? So before looking at the options, I'm thinking that low O2 sat, we have to increase supplemental oxygen. Number 2 is the low blood pressure. We got to increase that by increasing fluids. And then number 3 could be treating the infection by giving antibiotics. So now looking at option number 1, this one is correct. Prepare to administer IV fluids. So of course, this is going to stabilize that low blood pressure and save the client's life. Now option 2 is incorrect because again, there's no evidence that there's a cardiac problem. So an ECG is not the priority here. Neither is option 3, prone position or basically face down. We never want to do that with a client having shortness of breath or really any type of oxygen problem. So keep the head of the bed elevated because the client is short of breath. How about option number 4? Increase that O2 flow. Well, yes, this is correct. The O2 is at 87% on 2 liters. We need to increase the amount of O2 to increase it in the body. Now, the last option, option 5, is incorrect. This is basically a do-nothing answer. Honestly, a better choice here for option 5 would be going to the break room and taking your lunch. So remember, we need to take action now to save the client's life. We can't just wait until the client doesn't improve. So option 5 is totally incorrect. Woo! Okay, finally, the parameters to monitor. Remember, these bow ties are kind of like an obstacle course. So before looking at the options, simply think of the data in the case study. What would you monitor for to keep the client safe? So let's look at option number 1. Would we monitor for vision changes? Well, no, this does not directly relate to septic shock. This would be more vision problems. How about option 2? Blood pressure. Yes, look at that low blood pressure. We got to make sure to monitor that. Remember, septic shock, we have severely low blood pressure. What about option 3, monitoring the heart rate? Well, simply look at the data in the case study. The heart rate is high, so increasing heart rate compensates for that low blood pressure. So we definitely want to monitor the heart rate in option 3. Now, the last 2 options are incorrect, and let me explain why. In option number 4, utilizing a stroke scale, no. The data did not show the client had a stroke or even a history of a stroke or even a future risk for a stroke. Now, the client could have a risk for a stroke if the blood pressure was high, but the blood pressure is low here. What about option number 5, the pain scale? Well, simply look at the case study. Do you see any mention of pain? Well, no. So really think, why would you assess something or use it as a parameter to monitor for if the case study never even talked about it? Woohoo! Okay. Now, I know that seemed like a lot, but don't worry. You're going to be a pro in no time. Sign up for a free account at the link in the description below to keep your learning streak going.
Got him.